I think Mark and Mary are being very disingenuous about finance. It's very clear in all of the literature that finance is one of the major drivers for this, the major driver, and the part of shaping our healthier futures role is to put North West London's contribution to the £20 billion savings or cuts, call it what you will, that have been targeted in the area. Over the next 5 years, according to the BMA, age-adjusted spending per person will fall by 9% for everybody in the country. And what part of what is going on here, and, you know, there's an argument about whether it's legitimate or not, but I think it's important to be clear, is financial. So the SHA targets, the Shaping Our Healthier Future targets were to cut 344 million from the acute sector, 74 million from the primary sector, 44 million from the community, and 49 million from mental health. And I think that's important to know that's the context. Now, actually, in terms of the idea of centralising care and concentrating expertise in areas where that's necessary, heart attacks, major trauma, strokes, that's absolutely reasonable. That's exactly what I would want for me and my family, and that is not an argument. That is not controversial. What's controversial, however, is the scale of the cuts in this area and the timing, and losing so much sort of district general type capacity, when actually the mantra has been primary and community care will cope, and the background is that there are redundancies and cuts across primary and community care. There was a reduction in nursing. The RCN said 7,000. There's been a reduction in district nurses, for example, of 42% in the last 10 years. And in 2011, only 5 district nurses qualified in London. I think, you know, you need to look at, Claire Gerarda from the Royal College of General Practitioners at that time talked specifically about the strain that GP practices are under, and I want to make it clear this is not a criticism of people who are working in primary and community care. People, I'm sure including Mark, are doing a really, really hard job in very difficult circumstances, but it seems utterly irresponsible to try and cut not just A&Es. What hasn't really, I don't think, been mentioned enough is the 500 plus acute beds that are going to close in North West London, and what that's going to mean for healthcare. And just finally, in terms of talking about disinformation, a lady from Acton gave me your Ealing Borough Chronicle paper just as I came into this meeting. In there, the deputy leader of the Conservative group, I don't know your patch so well, Geoffrey Stafford, said, this is Ealing, the A&E both have, but this is the Ealing Borough, well, anyway, in terms of disinformation, same party. The A&E at both hospitals will be staffed by senior medics on duty. Well, actually, it makes a difference, because if you're talking about misinformation, the headline is A&E saved at Ealing and Charing Cross, and the quote is senior medics on duty 24/7. Now, actually, that's not true, because there will not be A&E doctors on duty 24/7, and I think it's grossly irresponsible to put that out into the public domain.
Yes, here.